A combination of visual therapy, nutrition, and lifestyle changes can help slow the progression of age-related vision problems and possibly even improve eyesight. But what if these problems arise from a stroke, diabetes, or congenital defect of the optic nerves?
Close your eyes.
Double vision? If you start seeing double images when your eyes normally work well together, you should take it seriously. The ability to see a single image with two eyes involves a complex system of muscles, nerves, and other optic parts. Double vision can occur when the eyes look in separate directions because of cranial nerve palsies. The disorders involve paralysis of the nerves that control eye movement. There are 12 cranial nerves. 3 of them are important to the eye: the 3rd, the 4th, and the 6th cranial nerves. When these nerves are affected, the ability to move the eyes is impaired. How eye movement is affected depends on which nerve is affected.
Let me demonstrate. The cranial nerves actually supply the muscles of the eye, and there are 6 sets of muscles. The muscles of the eye are responsible for the movements of your eye.
Take us through the muscles, just indicate.
Okay? If this is my right eye, this is the medial rectus, which actually, when on contraction, will help move my right eye inwards, while the lateral rectus will help move my right eye outwards. The other sets actually help elevate or depress the eye. As you can see, coordinated movements of both eyes is important to get single vision. In cranial nerve palsies, assuming you have a abnormality of the 6th nerve, which supplies the lateral rectus, the right eye will not be able to move outwards. Hence, if the patient has a right 6th nerve palsy, the left eye would be able to move inwards to look at an object on the right-hand side, while the right eye is unable to move outwards. Hence, there's a misalignment of both eyes, causing the patient to see double vision.
Treatment of cranial nerve palsies will depend on what caused the condition. Several conditions causing double vision are difficult, if not impossible, to fix. Some strokes and nerve palsies cause fluctuating double vision that can't be measured accurately enough to correct. In these circumstances, the patient may need a period of adjustment to learn to live with the symptoms. Most cranial nerve palsies go away without treatment when the condition that caused them improves. But some people may need vision therapy or surgery to help correct the double vision. Surgery can also result in cosmetically acceptable alignment of the eyes.
The causes of cranial nerve palsies are generally due to trauma, tumors, and in the case of 3rd nerve, it can also be due to diabetes. And treatment of cranial nerve palsies will depend on which of these it is. In the case of a diabetic 3rd nerve palsy, usually good treatment of its diabetes, good control of its diabetes, the condition can resolve on its own in about 3 to 4 months. However, if it is due to tumor and trauma, then the primary cause has to be treated. And then we see whether there's any residual misalignment of the eyes before that is treated.
As much as we would like to have bionic eyes, the reality is that our vision becomes less than perfect as we mature. Just as your physical health requires routine exams from your family physician, so too does your eye health. Many people fail to get regular checkups partly because they did not feel anything was wrong with their eyes. They assume that lack of vision loss suggests proper eye health, but this may or may not be true. However, even if your eyes seem to function well, it's important you get annual or biannual exams to help detect problems down the road early on.